This conference will now be recorded.
All right, folks, so we're going to be doing a lab. So if you didn't come up, those of you in classroom, if you didn't come up and pick up chapter 5, PowerPoint, as well as the homeostasis lab, come and do that now before we start, if you don't mind, please. So come and grab that. Make sure, again, that you get on the sign-in sheet for us here in campus. Yeah, so we're going to be doing a lab today. It's called homeostasis lab, and we'll be talking about what all that after we go through what we're doing as far as with our PowerPoint today. Okay. So we're going to finish up chapter 4, PowerPoint, tissues, organs, organ systems. Recall last class that we were here, first class, we discussed the organ systems, the Miss Curly Nerd, having to do with the organ system. So what does the M stand for, folks? Muscular, good. What does the S stand for? Someone else. Good. Okay, someone else for the C. Good. How about the U? Urinary, good. How about the R? Good. L? Lymphatic, good. I? Integumentary, there you go. Integumentary, the skin and these associated glands. N? Good. E? R? And lastly, D. Very good. Okay, excellent. So that's the organ systems. And so knowing that, so let's look over here. So the organism is composed of what? Organ systems. The organ systems are comprised of the organs. Organs are made up of tissues, good. Tissues, cells, right? And then we have on the more chemical and atomic level below that, right? So very good. So that's this chapter. We're going to be finishing up that today and discussing that. So let's go on and move into the PowerPoint here. So let's go here. All right, thank you. So this will be up here just in case anybody didn't get it, but I think everybody's gotten it so far. So let's take a look here as far as, so again, tissues. We talked about the group of similar cells, right? We talked about it over here as far as organs are made up of tissues, tissues comprised of the cells. The epithelium, this specific type of tissue that covers and lines, and that's the big thing there. If you can highlight that there, circle it, I've already underlined it, covers and lines. That's very important as far as what? Covering the body surface, lining the cavities, the tubes, the different organs, right? As a lining, that epithelial tissue. We talked about the different types of epithelial tissue. As far as we talked about that there is one layer or multiple layers, or a layer that looks like it's multiple layers, but it's not. That's the pseudo, false stratified. And here we looked at the examples of the images and how that young man does that. I have no idea. Very flexible to be able to do that. So next one here, next slide, just showing you as far as, again, examples, and also showing you that not only do we have different types of layers, but there are the shapes. The squamous kind of looks like a flat pancake. The cuboidal looks like a cube, looks like a square. Columnar looks like a rectangle, okay? And in different areas of the body where those, and we mentioned also about that the structure, right, the anatomy really determines the function. So if we're in an area where we need multiple layers, that makes sense that we're going to have stratified tissue there in order to be able to have layers removed and still be okay as far as protecting whatever part of the body that it would be protecting. And then here we talked about different types of glands. We reviewed this last time there, and we'll go over this again. It's just, in particular, we're going to be looking at the endocrine system, the E of that Miss Curly Nerd, right? Endocrine system deals with the production of hormones. So you tell me, folks, what hormones will we be looking at as far as what could be an example of a hormone? Say again? Growth hormone, good. We talked about what other one? We said starts with a T. Well, testosterone, good. How about thyroid hormone is another one, right? How about what? Estrogen, right? Progesterone, right? These are all examples of different types of hormones. Just a few. Produced by glands, right? These endocrine glands, and they're released into the blood. Go ahead. Yes, Hunter. What is it? Pheromones. We'll discuss that also. But yes, yeah, so we're talking about dealing with what can affect someone as far as by their experiencing this being released from something, someone, some creature, whatever it may be, and it can cause an effect. We'll talk about that when we talk about hormones. Exocrine. So exocrine glands, this is what we think of when we're looking at as far as sweat glands. Okay? How about oil-producing glands? We call them sebaceous glands, right? That's just an example of what an exocrine gland would be. Okay? Releases substances through ducts. A duct, a D-U-C-T, that's a term that we'll see come up quite a bit. A duct is just a tube. That's all it is, right? Just a tube. Now, connective tissue. Do you recall this? We talked about what was the fluid connective tissue that I mentioned to you? Do you remember? Blood, right? Blood. That's right, correct. So blood is a type of connective tissue. Look over here at this next slide, and it's just going to show you examples of. Did I go? Here we go. This is just give you an example of types of connective tissue. So you'll see here this fibrous and then the special connective. You all know, and when you think of this, you'll think of, we know what cartilage is. We know what bone is. Adipose tissue is fat. Hey, it's okay. Jan is doing scientific experiments. She's just producing specimens for microbiology. So adipose tissue is fat, blood. So we mentioned all these different types. So I didn't really mention to you too much about the loose, dense, and elastic, other than knowing that they have different properties in order to allow for, these different fibers are present within them to provide some type of function in the body. So when we think of, let's go to this next slide here, and we'll look at the image to the left. You're reading left, which is this one right here, this loose connective tissue. We also call that, there's another term that we'll use for it. It's called areolar connective tissue. And we looked at this slide last class, and you'll see here that there are some dark lines and some wider pink type bands. So here we're looking at elastic fibers, which are the dark lines, kind of looks like someone took a marker and just like drew across it. And then those purple or pinkish type thicker bands are collagen fibers. Okay, collagen is a very strong protein within the body, and so that's that areolar connective tissue. Look at where it says here, common locations. So if you see right here, common locations under the skin and most of the epithelia. So it's really a very strong type of tissue because of those collagen fibers, but it also has the ability, there's elastic fibers there, to stretch and to move a bit. So really an important type of tissue. Right? And really you're in the, kind of like the foundational base of your skin. Do me a favor, folks, right? So have your arm in front of you, okay? Put your other hand, just like the palm of your, not your palm, but more of like the fingertips on your skin, and move your skin in different directions. Move your skin in different directions, right? It's pretty interesting that it can do that, right? Yeah. It doesn't just like slide off or something, it sticks, but it can move a bit. The reason why it can do that partly is because of that areolar connective tissue and really the foundational connections of the layers of your skin. Take your fingers, do this together, do that kind of a thing. Interdigitate, right? So understand that the top layer of your skin that you're seeing right now and the second layer of your skin have these little ability to kind of interdigitate. And so instead of just having skin on top of skin and it's just like smooth, no, it's not like that. You actually have this kind of an action going on, so it has a better hold and can keep on, your skin just doesn't move off in like a big clump of skin, so to speak. It's kind of gross, right? Like a horror movie type thing. Ugh. Does anybody like horror movies or scary movies at all? Yeah, I'm gonna go to the, what is it? What is that? There's a place out by Scranton that we go to. No, it's one of those. Yeah, it's like there's like 3 of them attractions when you go to it. No, it's not that one. I know what you're talking about. No, not that one either. That one yeah, was that all right? Too funny. Yeah, it'll come to me. It'll come to me. But those kind of things, I just love. You're walking in the woods and like, kind of scary. So anyhow, back to connective tissue. So you'll see here that even as we're looking at these images right here, right? So this one and this one, you're seeing again 2 collagen fibers. Excuse me, very strong type fibers that compose these different types of connective tissue. And then all the way over here, we have cartilage, which is very unique in how it looks in its appearance and such. And let's see, I'm gonna move back a moment to okay, I'm gonna move back to this image and then I'll come back to here again because I want you to be able to see. Yeah, all right, so this is epithelial tissue. I want you to write this down. Epithelial tissue is tightly packed cells. Epithelial tissue is tightly packed cells. Tightly packed cells. Do you see this image over here to the right of our very flexible young man there? So we have see all those cells? They're all tightly packed together, squamous. See the cuboidal cells? Tightly packed cells. They're right next to each other. How about the columnar cells, right? It's like a little wall, right? Tightly packed cells. Now take a look at our slide again. We're coming back to this image. All right. Look at these. Do we have really tightly packed cells like we do in the other? No. What you'll have is you're going to have these different fibers present, right? We call it a matrix. So when we think of connective tissue, we think of cells in a matrix. Cells in a matrix. And folks, all that means, all that represents is just that as you're looking at this image here on the right, and you're seeing these nuclei that are dark stained and such, right? What do you see all surrounding and such? You see other type of tissue present there, right? And there's fibers present there, there's other, and that's the matrix. So it's cells in a matrix, not tightly packed, but epithelial tissue, tightly packed cells, okay? So it's definitely a little bit different. You'll see even as you look at these other examples over here also, you're seeing the darker stained nuclei within a matrix of tissue, okay? Now, this slide that we're looking at next just gives you an idea as far as, so what's going on with these specialized connective tissue, with cartilage, with bone, with adipose, with blood. And we talked about examples and such. So tell me something here in class, as far as the adipose tissue was concerned. So not only is it a storage area for nutrients, right? But what is another function for the adipose tissue, for the fat? You tell me. I gave you an example of something. Go ahead. We were talking about the kidneys, right? Yeah, that's very good. Yes. So it kind of, it cushions and holds up, keeps in place the different organs. How about the eyes? Do you remember the eyes? The patient will lose a lot of weight and actually they starving themselves, so to speak, right? Or someone with anorexia nervosa, right? What can happen with the eyes? They kind of can sink into the skull and such. So that fat is removed because it's being used as nutrients. So yeah, so fat is very important, adipose tissue. And so we talked about the other areas. How about cartilage for a second there? There are multiple types of cartilage. I don't know if you ever heard of that before or know that. Yeah, there's different types of cartilage, and they each have specific functions and such. Let's go back to the skeleton in the back here. Okay, so take a look as we go back here. All right, so this articulated skeleton, which has a broken finger. All right, so this area right here, cartilage. These intervertebral discs, cartilage. Between the pelvic bones, right here, pubic symphysis, cartilage. Okay, you're not seeing meniscus. Meniscus is a form of cartilage. Okay, that spacer there, that so it's not, your bones are not crunching and moving on bone. Right? How about this? Hello, my baby. See that? You see the jaw moving up and down, right? So opening and closing of your what? Of your jaw. What is this right here? What do you call this area right there? Okay, do this for me. Take your fingers, put it right in front of your ears, and open and close your mouth. Hello. Right? What do you think that is? It's called your TMJ. You ever heard of that? Anybody ever heard of that? TMJ. All right. So the TMJ, it's called your temporal mandibular joint. TMJ, I just always call it TMJ, so I'm not really saying out loud. But that joint right there is made up of a very strong cartilage. It's called fibrocartilage. The discs between each of your vertebra, fibrocartilage. It's very strong, very durable, has a whole lot of that that collagen fibers present. Okay, elastic cartilage, your ears. The cartilage for your ears, elastic cartilage. Okay? And so elastic cartilage would have a lot of elastic fibers present. Okay, and let's see, and hyaline cartilage. Hyaline cartilage, pretty much throughout your whole body, there's full of hyaline cartilage. There's only a few spots for that elastic in the fiber. Go ahead. No, it's more of a fibrocartilage. Yeah, that meniscus and such, it's very strong, very durable and such. Yeah. The problem with cartilage, as well as epithelial tissue. I want you to write this down. There's a term. Starts with an A. Avascular. So your epithelial tissue, your cartilage, avascular. Anybody know what that means? What does that represent, that term, avascular? No blood supply. That's right, no blood supply. Okay. So does cartilage heal very quickly or much at all? You're right. Yeah, but very slowly and not a whole lot. And cartilage, avascular. Epithelial tissue has tissue that's forming its foundation that has the blood vessels, blood supply and such, but your epithelial tissue does not. Have you ever scraped your skin, right, and it didn't bleed? If you do like a very light layer of it, well, that very top part of your, what's called your epidermis, it's not, what is it? If it's epithelial tissue, it's avascular, so it doesn't bleed. But if you just scrape a little bit deeper, right, because it's still pretty thin, then that's when you hit the blood supply, and that's when you'll start to bleed a bit. Yeah? So avascular, that's a good point there, and help you to understand a little bit regarding the different types of tissue. Muscle. We talked about muscle as far as knowing that there are different types: skeletal, smooth, and cardiac. Cardiac muscle, we get it, that's the heart, right? The heart pumps, it's a pump. It's actually two pumps, right? Pumping to your lungs and pumping to the rest of your body, systemic we would call it. We'll go over that in more detail, but that's the cardiac muscle. Smooth muscle, the organs of your body. Recall, oh, how about this? You ever get goosebumps? Goosebumps in your hair will kind of like stand on end, right? Can you make it do that? Can you make it like, it's gonna do that, right? No, it's not gonna do that. You can't, it's not voluntary. We say that it is, what's the term? If it's not voluntary, what is it? Involuntary. And, oh, I have an issue with spelling, so. Oh. Voluntary, yeah. So involuntary, right? And so can't control it, but voluntary, right? What can I do with my arms, right? I can walk, right? Skeletal muscle, you can control it. So skeletal is voluntary, smooth and cardiac involuntary. Let's move on to the next slide. And you'll just see here, as far as, we call it skeletal muscle because what? It connects, it anchors the muscle, right? This type of muscle that's going to move the skeleton, it anchors it. And what does it anchor it by? How does muscle attach to bone? You tell me. Is it ligaments or tendons? Anybody know? Ligaments or tendons, muscle? Tendons. Muscles connect to bone via tendons. They anchor to bone via tendons. Bones connecting just to bone to bone, ligaments. So write that down. Go ahead. Yeah, question. Sure, yeah, I'll put it down on the board here for us. Let's see here. So muscle to bone, tendon. Bone to bone, ligament. Right. So what anchors muscle to bone? Tendons. So an extension of the muscle is a tendon. So if I have, so how about this? If I have a tendinitis, if the doctor says, or he or she, whatever they say to you as far as your diagnosis, would be a tendinitis, what would that be? An inflammation of a tendon, right? The ligaments, they're what keep the bone together. Okay, they're really what help to anchor the bone together, because look at our skeleton in the back again. So our skeleton in the back, you can see some examples of cartilage that's present. But really, what's helping to keep the bones anchored with each other and such? It would be ligaments, okay? And that's very important to keep in mind and to remember. Ligaments keep bone and bone together. So you're going to have a combination of soft tissue. So if I were to say hard tissue would be your bone, soft tissue would be muscle, ligament, tendons, right? And so if you fracture a bone, right, you break a bone, there's a break in the bone, right? That's going to heal. That'll get pretty strong in the area where it's healing. How about if you overstretch and tear ligament, tendon, muscle? That could take, yeah, that can take more time to heal, to be honest, than a clean break. Yep. So ligaments, tendons. We talked about that already. We looked at the striations. We'll go into more detail regarding this, but you see the lines and such here and here. Cardiac and skeletal muscle, there are lines. Smooth muscle, no lines, no striations. Okay, so just looking at the histology here, you're seeing the striations right here for skeletal, right here for cardiac, but smooth muscle has no striations. All right, now we get into nervous tissue. Let's everybody stand for a moment. We're not taking a break, we're going to stand at our seats and we're just going to do the old 7th inning stretch. Stretch it out a little bit. All right, yeah. We are not going to sleep in Dr. Perron's class. No worries. I know it's hard, you know, after lunch and such, you're like, but no good. All right, folks, have a seat. So nervous tissue. Nervous tissue communication. So communication takes place in order for your brain to speak to areas of the body to function and to do their work, right? As well as we're going to have what? Communication to the muscles so that we can actually control voluntarily what's going on as far as our skeletal muscle is concerned. So really important, and we'll go into a little bit more detail regarding that, but know that nervous tissue is comprised of nerve cells. Nerve cells are called, right here, neurons, right? Nerve cells, neurons, very important. They can carry signals, they can carry these signals are called nerve impulses. We also use a term called action potentials and gradient potentials. There are these different types of chemical events that will produce an electrical event, bioelectricity, you could say. It's just like you see, so look up above, look over here, folks. In the room, those of you online, I'm just pointing to the different wires on our big screen TV here. See all these wires, right? How do we get the juice, the electricity from the outlet to the machine to here? I mean, simple enough, right? It's just wires, right? So do we have within our human body these quote unquote wires, these nerves that are carrying these bioelectricity, these electric potentials to different areas to cause control and communicate? Absolutely, yeah. So the nervous system is a quite interesting chapter that we'll be going over and looking at. You'll see here, not only do we have these neurons, these nerve cells, but we also have these neuroglia, these support cells. So the neurons, they're actually creating the electricity that's going on and taking place. The support cells, they're a part of and they're supporting, and we'll go into more detail regarding what they do. Nervous tissue. All right, we'll just talk about this briefly here, okay? So stem cells, you've all heard of these before, I'm sure, in the news and such, and how these are cells that are undifferentiated per se. Now, there are certain stem cells, so this would be like in fetal tissue, preborn type tissue within babies that are not born just yet, okay? Stem cells with us, we have stem cells within us right now and in everybody's body here, as far as that will produce, that will become, how about breast tissue cells? How about muscle tissue? How about nerve tissue? Whatever it may be, they're gonna become something. What the type of research that's going on as far as in using different types of stem cells would be for seeing if we can take a stem cell that should be differentiating into one type of cell and create it to produce like nerve cells. So how about people who are in accidents and they become a paraplegic or a quadriplegic and they're paralyzed? And hey, how about if we could then regenerate nerve cells and such in order to then help them to regain the ability to walk? Would be remarkable, right? Well, at this point in time, that's still, the technology is not there yet, okay? They're still doing the research and trying to do this, but you know, we can do certain things. We can, in the lab, produce skin, yeah, from stem cells and such. We can, so this is something that was been in the past like 20 years, and it's been done in Japan and also being done here in the United States, where we can have a patient who is having a mastectomy, right? So they're removal of a breast or both breasts. They remove the breast tissue, and instead of having to get then a implant, we can actually take stem cells from the breast, from healthy breast tissue, and create breast tissue that can fill the space where the bad cancerous breast tissue was present. Some pretty wild stuff, right? So it's not going to turn into anything. So it's not going to become, oh, sorry. It's not going to become breast. We take adipose tissue. I apologize. Sorry. We take adipose tissue, fat from liposuction, those stem cells, and we produce adipose tissue that will fill the space where the breast tissue was removed. I apologize. Do you understand? So in other words, instead of where we had breast cancer, we remove all the breast tissue so that the patient is not going to be sick, right? And then we replace it with liposuction, taking fat, these particular stem cells, fat cells, right, adipose tissue, putting it in the area, the space where the breast tissue was, and it will over time produce fat that will take up the space. So it's a non-functioning breast. So in other words, the patient can't get pregnant and produce milk, right? That's not going to happen. But the space where they did have unhealthy tissue will be replaced by healthy tissue. That's some pretty wild stuff. Go ahead, please. Yeah, so they'll actually concentrate it. They'll actually concentrate it and then give time for it then as they inject it into the space where the breast tissue was, that it'll actually start then reproducing and replicating and producing healthy adipose or fat tissue. Well, it will, yes, but in the space. So they're taking, so it's not like it's all gonna fill up right away. You understand? So it's gonna take some time, but that will replace that area with healthy adipose tissue, not breast tissue. Yeah, it's pretty wild. All right, let me just fast forward here. And we talked about, so we looked at, next slide here. As far as the junctions, the areas where we're actually keeping the cells of the tissues together and such. And so I just mentioned to you a little bit about this last class. Just know that this is what's going to help keeping the cells together. So you're seeing here an example of the muscle tissue and how those junctions are keeping everything together and allowing for a communication to take place. So thin sheet-like covers, these membranes, okay? So membrane, epithelial, the tightly packed cells, or connective tissue, the cells in loosely based matrix there, okay? They're not tightly packed cells like the epithelial. When you see this term here, mucosa, think mucous membranes. So how about for your sinuses and your nasal passages? Mucous membranes, right? Now, mucus is not a bad thing. Mucus is a good thing. It's able to help to prevent. So in the case of your nasal passages and such, it keeps them moist so that the tissues and the cells don't dry out. That's a good thing. How about in the case of, say, your digestive system? If you have mucus present, it's going to prevent the acid from your stomach from eating away at the stomach lining. That would be not a good thing, right? How many of you have heard of an ulcer? Peptic ulcer, gastric ulcer, right? Ulcers are what would create like holes within your digestive system because there's something going on and there's a process. We'll talk about that in more detail, but just know that mucus, not a bad thing, it's a good thing. But sometimes we can have too much mucus. All right, so you're seeing here that the different types. So mucus is one that we talked about. A serous membrane, do you remember this one? Remember this one, folks? We put our hands together, we move them. What's created by doing that movement? Heat. So how do we reduce the amount of heat that can be produced as a result of friction from organs moving? We have these serous membranes. And there's a little bit of fluid between the membranes, and it allows for your organs to move and not build up that heat. That's a good thing. Cutaneous membrane would be the skin, part of your integument. And then a synovial membrane, this is for joints. These are hollow joints filled with fluid. Why don't you write that down? Synovial joint, hollow joint filled with fluid. Synovial joint is a hollow joint filled with fluid. And we'll be looking at articulations in this, after we look at the skeletal system, we'll look at the joints and such. And this next image here, this is just giving you an idea as far as the different types of membranes present. So you're looking at the lungs, you're looking at a serous membrane that can be covering an organ, say the heart. Because again, what's going on with the heart? The heart is constantly beating. Again, I said to you that the heart is two pumps. So it's constantly moving. So constantly moving, we don't want it to build up heat. That would be a bad thing. Now, can you have situations where you can have the coverings and of the different organs, can they become inflamed? Can there be infection? Yes, absolutely. That's not good stuff. Cutaneous membrane, again, you're seeing an image of skin, and then that synovial membrane. So again, this synovial membrane lines this synovial joint, which is a hollow joint, and the synovial membrane is producing this fluid that's present within the joint. All right, this next slide here. The organ systems that Miss Curly Nerd, we know that. But you'll see here that there's some cavities. Cavity is a space. Cranial, spinal, thoracic, abdominal, and pelvic. You should know what each of those are and what they contain. Okay, so just having an idea. Cranial cavity, spinal cavity, so you're looking at for the brain, for the spinal cord. Thoracic cavity, what's your chest, right? You would quote unquote say your chest. Abdominal cavity, in through in here. Pelvic cavity, inferior word, for your reproductive organs. And this slide here is what we talked about really at the beginning of class, right? From organism to the cellular level, right? Tissue, and so you have organism, organ systems, organ, tissues, and cells. That's what you're seeing represented on this slide right here. And just looking at that, right here. Okay, so we're almost done with this PowerPoint. Let's take a look here. Give me one moment just to. Yeah, just a few more slides and we're done with this chapter. So I think right before break, we'll take a break in about 10 minutes, okay? And so we'll just finish up this chapter and then we might just, I'll introduce chapter 5 and then we'll go over that next class. So here we're seeing as far as the integumentary system contains, right? So it's not the skin alone. Skin, hair, nails, oil, and sweat glands. So all of these structures are composed of, the integumentary system is composed of all of those structures. They say if you were to take the I'll show you an image probably next class. I won't be able to show it to you this class because I have to look it up. But seeing a have you ever watched any video on YouTube regarding they'll look at cadavers and such, which would be a dead body, and they do a dissection of that? It's pretty remarkable, pretty amazing. There was a BBC show, television show that was that they actually showed. It was like a couple episodes and such, and went over different actual organ systems and such. And one aspect of it was they actually skinned the cadaver, and to see the surface area, it was just like, whoa, it's pretty amazing, pretty remarkable, and pretty heavy too, your skin. So largest surface area of any organ is the skin. Contains that epidermis. That's what the epidermis and the dermis, when you think of there's two layers of skin, those are the two layers, the outer and the inner layer. The epidermis is the outer, the dermis would be the next underlying layer. Those are the two layers that go together like this, folks. And we talked about that in the beginning there, right? So that they stay firmly tight together. The hypodermis, or the subcutaneous layer, have you ever heard someone say sub-Q at all? Have you heard that term? That's subcutaneous layer. That's the anchoring layer for the skin, which is the two layers. Recall when I said to you that if you saw a ray of light come into the room, a dark room, remember I said to you that you saw those little particles and such, and that's you. That's your skin cells. right? That dust, primarily, that's what it is. That's that stratified squamous epithelial tissue, that epithelium. Multiple layers of these squamous, these flat, thin cells, kind of like pancake looking, those would be your epidermis. That's what it's composed of. Here, what you're looking at, this next slide, you're just seeing the different structures that are present in lab. We will go over some of these structures in the lab that you'll have to identify. And again, when we do any lab quiz, again, we only have 2 of those. You're going to have a word bank to be able to look at and to go with as far as when you're taking your quiz. Okay? But you'll see here that we have hair, and it's anchored. You'll see that there is, the yellow represents nerves, the nervous tissue. This is muscle. And so, yes, that smooth muscle can contract, and it can make your hair stand on end, right? That's called the pili muscle, and it's smooth muscle. There are different cells present within the epidermis. Keratinocytes, making keratin. Keratin is a protein. Write that down, circle that, because it says here, water insoluble protein, keratin. So your hair, keratin, right? Very important protein. Whenever you see a word that has CYTE, that's a cell. CYTE, site, CYTE, site, that equals a cell. That's a cell. So a keratinocyte, a keratin producing cell. Melanocyte, a melanin producing cell. So that's for pigmentation. And again, we said the glands, sweat glands, oil producing glands. Okay? Those are those exocrine type of glands. And can you have issues? Can you have problems where that glands are producing too much sweat or producing too much overproduction of oil and such? Absolutely, right? Skin disorders. Blisters, acne, right? Cold sores as a result of a virus, right? So different types of, go ahead. Yes, it is very common. And sometimes they'll label a skin condition eczema because they don't have an understanding of what else it could be, but just some type of irritation to the skin and such. But yeah, it's really like it's kind of a broad-based diagnosis, we would say. Yeah. Mm-hmm. Vitiligo. This is quite interesting, and I have it in my wife's family. And it doesn't depend upon. So you might have seen examples of people who are darker skin, but also of lighter skin, also can have these patches of white patches where the melanocytes die, and it's an autoimmune type disorder. Okay, autoimmune type disorder. So looking at the skin and the pigmentation, there can be white splotches where there's no pigmentation. That's vitiligo. Carcinoma, melanoma, forms of skin cancer and such, and affecting specific types of cells in the skin. Now, today, we're going to be doing a lab, and we will, after the break, I'm just going to introduce chapter 5, and then I'm going to have you start with doing this lab today. Okay? And it's going to talk about, really, the lab is about homeostasis, the ability for the body to have a stable environment no matter what goes on outside of your body. So, case in point, it's hot outside, right? Hot outside, yet your body tries to do all that it can to maintain the proper internal temperature, okay? But what inevitably will happen will be that you go outside, it's hot, and you get what? You get hot, right? Your temperature will get hot, and what does your body do in order to cool you off? We sweat. Hey, we sweat, absolutely. So yeah, that's an example of homeostasis. So today we're going to be looking at pulses, We're gonna be checking pulses, and we're gonna be having one of a couple of people in your group do different types of movement, right? And we'll see like what goes on as far as when, as a result of movement, pulse rate should go up because there's going to be more of a demand for blood flow to the muscles of your body in order to do that type of movement. So we'll be looking at homeostasis. Each cell engages in activities to ensure its survival, because it's really, remember, it's all of the cells of your body within the tissues working together. I like to think of it like an orchestra, right? I don't know that did I give this example last class? I don't think I did. I did it in my anatomy class. It's like an orchestra that works all together, and everything sounds good when it's healthy. When people in the band are sick and they're not playing, or they're not playing the right tune, or they're out of key, right? What happens? It's like really not good sounding. Have you ever been to a kid's like a play, or like where they have a band and it's like it's like, oh. I've been to many of them, unfortunately. Holy cow. And you appreciate that they're doing their best, but sometimes their best is not good enough. No, it's just, it doesn't, it just sounds not so good, but that's okay. They learn. But really, honestly, think about your body as an orchestra, all the organs and the cells and the tissues working together to keep you healthy. When things are not working right, disease. So homeostasis is very important, folks. I want to go to, let's see here. All right, so here we go. Look at this image here next, and we'll stop here because then we're going to go into the lab. We're going to take our break, look at chapter 5 for a moment, and then go into the lab. So look at this here, folks. There are sensors in your body, right? Sensors in your body, cells in the eyes, ears, skin, throughout, that are going to be receiving input, right? And they're going to then send information to the brain. The brain will then respond to the input that it's receiving and create some type of output to the effectors, to the muscles and the glands, to create some type of change to respond to whatever input the brain is receiving, to maintain this homeostasis. I lied, one more slide. Negative and positive feedback. So primarily within your body will use this negative feedback. So circle it. And those of you who are here in class, circle it. Negative feedback. That's the one that primarily your body will use, negative feedback. Alters a condition in the external or internal environment to react to the change. And what will happen is that this is the main control mechanism for maintaining homeostasis. I already said that. It's going to, so example, say your resting blood pressure would be 120/80. Well, how about if it went up to like 140, right? For whatever reason, you're stressed out, you just saw a car accident, or someone is like, you were in a scary amusement park, like you're talking about, like, yeah. It goes up. What brings it down to the 120/80? Negative feedback mechanisms will do that. How about if the blood pressure goes low, right? Goes low, same thing. It'll bring it up to the 120/80. It'll bring it up. So negative feedback is always bringing it back to the set point, we would say. Write that down, set point. Set point. Okay. So just like when you're thinking of body temperature, 98.6 Fahrenheit, right? Although during the pandemic, we realized that many of us are much lower than 98.6 on a regular basis. But let's just take 98.6 Fahrenheit. If it goes too high, negative feedback will bring it down. If it goes low, negative feedback will bring it to 98.6. Positive feedback, it's different. Think of positive, when you hear the term positive, Don't you think of the plus sign? Positive. So think about this with positive feedback. Positive feedback will enhance, it'll add to whatever is present. So positive feedback would take, say it's say 120/80, right? As far as we're talking about blood pressure and such. How about your blood pressure goes up higher? And then positive feedback would do what? It would make it go further away from the set point of 120/80, or further down as far as below that. Whatever it may be, it's going to take it away from where it should be. Positive feedback intensifies the change, adds to, plus sign, adds to the change. But in the case of childbirth, this is important to remember. In the case of childbirth, positive feedback is a good thing, because we want the baby to be born as quickly as it possibly can, right? And to pass through the birth canal. So when the baby's head hits the cervix, right, and it starts creating information that's being sent to the brain saying, hey, baby's wanting to come out, right? Let's increase the strength of contractions and how quickly the contractions are together, closely together, so that we can birth the baby out as soon as possible. So it intensifies as time goes on until what? Baby is born. That's a positive feedback that's healthy to take place. Okay. All right. A lot of information. Take a break. Take 15. Come back, and we'll look at chapter 5. We'll just introduce it, and then we'll also we'll begin then our lab for today. Hold on one moment. Hold on one moment.
This conference
Okay,
will
those of
now be
you
recorded.
online, we're going to come back in a few minutes. Let's see, I'm trying to get my. Okay, class. So we'll come back in a few minutes. But take 15-minute break, and then I'll come back and I'll introduce chapter 5. And then while the class is doing their lab, I'll just talk to you a little bit about what I'd like you to do as far as lab assignment. Okay. All right. So see you in 15. Okay. So yes.
So like, I did like 10 slides already for
Wow.
my presentation. Like, does this look like good or?
Yeah, it does. Yeah.
And then I have a link to something my neurosurgeon goes.
Good. Yeah. Cool.
Right.
Absolutely. No, that's good.
Right.
Yeah. Very good. Yeah. Hi. Oh, good. Yes. Good. All right. Good. Collect those. Still recording. Okay, interesting. I thought I had stopped recording and apparently I did not. So I'll have to check that next time. So folks online, can you hear me?
Yes.
Okay, very good. I just wanted to confirm I had shut off my mic before. So, all right, so very good. So we're going to be looking at, so folks here on campus, we're going to be looking at chapter 5, just the first couple of slides and just talking about it a bit. And then we're going to get into our lab portion of the class for today. Okay, so let's hide everyone and share my screen with you all. Okay. Okay. All right, so we're in chapter 5, folks. So this is the skeletal system. Here we go. All right, so the skeletal system. So in this class, I'd like you to be able to learn some of the bones of the body, okay? And so for the practical portion, the lab quiz that we'll be doing, again, you'll have a word bank, so you'll have a list of the bones, but I want you to be able to start learning the bones and such. And so that'll be a part of next class, not next class, next week, we'll be looking at the skeleton. So we have the 2 articulated skeletons in the back, as well as boxes of bones and such. And so we'll look at those. All right, so, but the skeletal system, very important as far as it's the foundation really upon which organs are protected, right? And muscles are anchoring to. Okay, so very important, the skeletal system. We said it was hard tissue. We said it was connective tissue. You'll see here that it's living cells and matrix. So we said if it's connective tissue, it's cells that are spaced within a matrix, right? So it's not tightly packed cells, it's connective tissue. So it's living cells. And so folks, look up here at the table. All right, this is hard, right? The countertop is very hard, but it's not living. Your bones, they're hard, right? They're hard, but it's living tissue, right? And this is remarkable, really, because understand that bone, when it fractures, what happens to bone when it fractures? Is there bleeding that can occur? Yes, because there's blood present within bone. Now, cartilage, we said, is avascular epithelial tissue, avascular, no blood vessels. Bone, highly vascular, okay? A lot of blood vessels passing through the hard tissue. See here, 2-layer membrane called the periosteum. There's a covering of bone, right? And this covering of bone, that inner layer, this is what's going to actually help to produce more bone. These bone cells are osteoblasts. There's multiple types of bone cells. Osteoblasts, starts with the B, osteoblast, build bone. Osteoblast, build bone. They create, they synthesize, create bone. That's those, that in the inner layer of the periosteum, that covering of the bone, there's an outer and an inner layer. The outer layer is that dense connective tissue. It's really, really tough tissue. It's a good thing. Protective. The inner layer, bone cells, and in particular those osteoblasts, those cells that will build the bone. Recall I said to you that a cyte, C-Y-T-E, is what? A cell, right? So an osteocyte is a what? A bone cell. And in particular, this is a mature bone cell, osteocytes. So mature bone cell means it's not growing any further. Osteocyte, a mature bone cell. Osteoblasts, they're involved in what? Building bone. Now here's something interesting also about bone cells and about bone in particular, bone tissue. So we said that what? Bone is what? It's hard, but it's living. And it's continually over time breaking down and building up. So bone will break down old bone and build new bone. Okay, so bone will, so in order to replace the bone that you have, break down the old, build up the new. Okay, so look at this next slide here. There we go. Oh, it's not here. There we go. Types of bone that are present: compact and spongy bone. Compact, when you think of dense bone, compact bone. Spongy bone, what does a sponge look like? It has kind of holes in it, it's porous, and you're going to have a lot of blood vessels flowing through that and such. And nerve, right, passing through those holes within the bone. So it looks lacy, delicate, but firm and strong. Compact bone is dense. It also has holes present where blood vessels can flow through. So know that. And there's a cavity inside of this compact bone where we have the marrow. And bone marrow, two different types. There's one type of bone marrow that will actually, it's called red bone marrow, that'll produce blood cells. Producing blood cells, synthesizing blood cells, the red bone marrow. Yellow bone marrow, adipose tissue, storage of adipose tissue. It's pretty wild. So you have compact and spongy bone. You have red. So write this down. I'll put it up here for you all. Marrow, red, yellow. Yellow, adipose tissue. Red produces blood cells. Have you ever heard of a bone marrow transplant? Yeah, well, why would they be adding new, healthy marrow to a patient? Yeah, they're having issues with their immune system. And so we want to reboot their immune system and give them healthy blood cells that will be a part of their immune system. Very important. Yep, so very, very important for sure. And we'll end with this image right here. And we'll go over this again next class. But you'll see here that, see how this, oops, you won't see that. Here we go. You'll see that the red, that's blood vessels present. So here we have holes within the compact bone and within the spongy bone where blood vessels will go. So you see here, compact bone, spongy bone. And there are different areas that it's located, and we'll review that on next class on Thursday. Okay, folks, very good. We're going to stop recording right now.